All right, let's call the Community Health and Safety Task Force meeting for January 25th, 2022 to order. Can we have a roll call, please? Somebody.
Okay, greetings. Yes, greetings everyone and welcome. If we can get a roll call for the task force. Renee.
Annie Rasquin.
Annie, thank you.
Bruce is here.
Councilwoman Renee Villarreal, and we have Emily. Sorry, I'm trying to see everybody. I've got presentations popping up on my screen here. Emily is in Marcella. Is Marcella here?
Yes,
Marcella's here.
Thank you, Marcella. And Mary Louise?
She's having trouble with the link. Oh, did you get it? I don't see you. Where are you?
I'm here.
Yay. Okay.
Great. I believe we have everybody.
Great. All right, so we have a number of presentations tonight from city staff. So I'd like to welcome all city staff that's here tonight. Director Ochoa, is there anything you'd like to say before we get started?
Thanks, Mr. Chair and members of the committee for having us here. I just wanted to say that we have an incredible team of people, so I'm going to do my best not to talk too much because they have a lot to say about all the good work they've been doing. I think what you'll hear tonight when you hear about the Mobile Integrated Health Office and its evolution, as well as the Alternative Response Unit, is really, if we think about it, in many ways an evolution of public safety. And it's absolutely appropriate for our times. And I think Santa Fe should be very proud that we have been early adopters of some of these kinds of responses. The vision of the Community Health and Safety Department, of which I'm the director, is that a healthy community is a safe community. Very fundamental. And so the more we invest in the health of our community on the front end, of course, from a public health standpoint, as a public health person, when we address our social determinants of health and the reasons that people are finding themselves engaged in the justice system or in ER visits even, the theory of the case is that we will put less stress on our public safety first responders. That said, they have had to retool and respond in very creative and innovative ways across many decades. From the fire department becoming a paramedic, having a paramedic service, to the police department addressing domestic violence in partnership with Solace or sexual assault. So there are a lot of examples of how public safety has tried to take on some of the social ills on the front end. But I think what's exciting about having us all in one department at this point is that we can properly invest in relieving the burden really on the police, on the fire department, by introducing these new service lines, if you will. And more importantly, that members of our community who are suffering crises, mental health, substance use disorder, and other crises get the appropriate response they need. So with that, I'll just turn it over to Chief Joy and Chief Moya to talk a little bit more about their perspective, and they can introduce the team.
Director Ochoa, the order that we have is MIHO, Thrive, and then ARU. Is that the appropriate order, or does it make more sense to mix them up or have something before the others?
Thanks for the question. Chief Mercado has put together a presentation that follows that order, and I think it's a natural progression. So we can stand for questions at the end of it, I think, that may relate to all of those things, but okay. I think that might be the best way to take us through it.
Thank you. Welcome, Chief Joy.
Councilor Rivera, members of the committee, nice to meet you all. I think I've met and spoken to a number of you in a variety of capacities throughout my career here. But yeah, no, I'm happy to be here, happy to be a part of this program and part of the larger community health and safety department. I think Chief Mercado has put together a great presentation. I think it's been a great experience for us in the police department to work with the fire department and the larger community health and safety department, and trying to find better ways and better solutions to some of the issues that are affecting our community. I keep saying over and over again to a number of folks, and Director Ochoa and I just got off of another interview saying that with a lot of the things that we're seeing are larger than what the police department can or should handle. And there are a number of larger, broader issues that are affecting our community that you can't and shouldn't try to arrest your way out of. And so being involved in these types of programs and working with these folks and other community members, yeah, it's a great thing for us, and it's an exciting thing to be a part of.
Thank you, Chief Joy. Thank you for being here. Chief Moya.
Thank you. Thank you all. Councilor Rivera, members of the committee, thank you. I was part of this as an assistant chief, and now that I am the chief, I am able to move it forward. I want to thank the team. Most of them are in this room with us today. I want to thank them all. Without them, this wouldn't be possible. I'd really like to thank Chief Mercado. I lean on him a lot in these areas, and he's really instrumental in helping me move the department forward in a positive direction, and move in ways the fire department hasn't thought of, in the past in a long time. So I don't want to take any more time. We have a lot of stuff that we would like to share with you all. So I want to let Chief Mercado speak, and then we will stand for questions after, whatever you committee members have for us.
Thank you, Chief Moya. Appreciate the introduction. We're on our first presentation with Mobile Integrated Health Office. So if we can, I believe Chief Mercado was going to do that. Chief Mercado.
Is it okay if I go ahead and share my screen? Okay.
Yes, sir.
Okay. Are you guys seeing the presentation? Okay. So
we're also seeing the miniature slides on the side of it. Is there any way it can pick up the entire screen?
Sure.
I think, Chief, if you go to slideshow, you might be able to show it in the form they can see it better.
How's that?
Oh, we're still seeing next slide.
Yeah, I'm on slideshow view, so I'm not sure why.
Can you click the little button up there in the top, that next to the left? Yeah.
Is it still showing up? I'm in. So I hit the slideshow button, and it seems to not be.
Yeah, that's okay, Chief. Go ahead and continue. I don't want to take too much time.
Okay. So sorry about the technical difficulties. It looks like now I'm on slide 2. Sorry about that. Okay, so thank you. Good evening. A little bit of background about me. My name is Andres Mercado. I'm a battalion chief rank with the fire department. I oversee the Mobile Integrated Health Office, or MIHO. I'm really thankful for your invitation to share. I've been able to tune into some of your meetings in the past, and I'm really glad to have good, committed people looking at issues. A little bit of background about me. Went to Santa Fe High, dropped out as a senior, got my GED at the community college, then got my associates at the community college, and a bachelor's at UNM, as I did that part-time as I was working with Santa Fe County Fire Department, and then got a master's at St. John's College. So all here in New Mexico. I started with the Santa Fe County Fire Department in 1999, so that's 21 years ago. And I've been in the fire service ever since. I live here in the city. I live in District 2, I'm married with 2 young kids. This is my community. I'm originally, I was born in Puerto Rico, but I consider Santa Fe my home and my community. And I'm just really thankful to have the privilege to work for the city and to serve my city. I want to make 2 acknowledgements before we start. First, I want to acknowledge that we are on native land. It's a complicated history, but these are the lands of the Tesuca Pueblo and other indigenous groups. And I also want to take a moment just to acknowledge the MIHO staff that are here tonight. And I hope that you have an opportunity to hear directly from them during the question and answer period. So as I mentioned, I worked with Santa Fe County for some time, and my time there gave me a good view of a lot of these issues at the county level. And then since joining the city in 2011, I've gained a much better appreciation for the unique challenges that face an urban metro area. My point of view of what we're going to discuss tonight is informed by my experience as in the fire EMS side. So when I speak about law enforcement issues, just please keep in mind that it's really from a limited experience of a really complicated profession. And we're going to talk a lot of system stuff and theoretical. So I just want to start by grounding us in a real example. It was a residence with multiple calls to police, EMS, and sometimes both. So just to give you a snapshot, there was 16 calls there in 2 weeks. The initiating encounter was mom called 911 to try and get a mental evaluation for her son. She reported delusions and paranoia about the neighbors conspiring against him. On the way to the call, the crew talked with family members and got some of the backstory. And here's essentially the narrative. I'm going to read this. It says, meet with him and chat regarding concerns. When we meet, he expresses that he does have some history of being on medication due to hearing voices, but stopped taking it because he was feeling better. During meeting, it is clear that he is obviously actively having auditory hallucinations. He keeps asking me if I had heard neighbors saying things and crying, which I didn't. He expresses that he is wanting to prove to his family that these neighbors are conspiring and that they are all in danger because they won't believe him. Consult with Nicole about plan of action. Decided that we will follow up tomorrow morning to try and connect with mental health services. Currently reports that he only takes certain medication, trazodone to sleep, and is completely sober otherwise for the last 2 months. So this is a client in his 40s who has had a good life, but in the last years, he has become paranoid and delusional. His family tells the ARU that they just want him back and that they used to live a good life with him, and now he is not able to enjoy life with them. Mom called after months of managing an increasingly difficult situation. Client would call the police complaining that the neighbors were conspiring against him, and she would call dispatch and ask them to cancel because it was her son who was making up stories and please not send anybody. ARU and case management began to make both proactive and 911 response contact. The client was introduced to Crisis Triage Center. That's the folks funded by the county, La Sala, and the Mobile Crisis Response Team. I'll refer to them as CTC for Crisis Triage Center. So to the CTC staff who began to assist the effort. ARU and CTC staff began to get a better idea of the severity of the situation as they worked with client and his mother. Due to escalating paranoia and homicidal threats, providers wrote a certificate for evaluation and client was transported to Christus. CTC staff and MIH clinical supervisor Nicole Alt communicated with the hospital and provided key supportive documentation, and the client was admitted to the BHU. That's the behavioral health unit at the hospital. Client remained in the BHU due to increasing homicidal ideation for about 30 days. That's unusual to have someone in the BHU for that long. Client was discharged with a treatment plan requiring him to be in contact with the CTC staff. Client then spent a few very cold days on the street and was transported back to the hospital due to a medical concern. While in the hospital, client continued to display homicidal ideation and was readmitted to the hospital. The client stabilized after 10 days on the inpatient side and was discharged on psychiatric medications to a shelter where he has remained for the past month or so. He is engaged with his mental health provider and is seeking employment. Client has been able to begin the process of rebuilding a relationship with his family. So this is just one example of the ability to connect folks with resources and see a person sort of through the system. That documentation, that amount of background that the crew was able to provide for Christus likely led to that long stay, which is oftentimes necessary in its successful. It's only we're only able to get it once in a very long while. So that's just to sort of in a concrete example. So sort of a 50,000 foot view of public safety. Between the police department and the fire department, City of Santa Fe public safety personnel, as you can see there, have combined about 116,000 encounters with the community every year. These calls, as you all probably are aware of, come into the dispatch center. The dispatch center makes decisions about whether it's going to go to the police side, the fire side, or both in some cases. I could probably get an education from the task force members about the history of policing in this country, but they were essentially established to manage criminal activity. Fire brigades, on the other hand, were established to battle structure fires. EMS agencies came along much later in the 60s, and that was sort of the medical skills that were learned in Vietnam were deployed systematically across the country to assist with what can only be described as carnage that was happening on the American freeway. So you were more likely to survive a traumatic injury on the battlefield in Vietnam than on an American freeway. So they wanted to bring that back to the United States. So it's really focused on traumatic injuries. Traumatic injuries, however, have decreased as a portion of 911 calls over time. And now the leading drivers are illness and unmet health needs in the community. So you're now more likely to find EMTs and paramedics in people's homes, homeless shelters, and street corners than in a major, the wreckage of a motor vehicle accident on a freeway. And the training, as with many industries, training has lagged behind. And a look at a police or fire academy syllabus from across the country probably doesn't look radically different from training programs decades ago. And although some departments offer training that is rooted in modern day challenges such as behavioral health, initial and the ongoing training remain fairly traditional. So a quote from PD officer, Captain Matt Champlin, was that although police officers are taught how to navigate an interaction with an individual mental health crisis, the navigation to available services and follow-up is a critical component that is not within a police officer's wheelhouse. Yet, that's often exactly what they and firefighters are being called to do. As far as deployment models, there are all sorts of configurations in different parts of the country and different locales. So I'll just stick to the city of Santa Fe. Santa Fe PD deploys in single officer police cars. It varies by time of day, so they have a dynamic staffing and maps onto call volume. The fire department is what's known as a single tier fire department. So there's no private EMS. The EMS is delivered through the fire department, and that's delivered through 7 paramedic ambulances and 7 fire trucks. So the ambulances have 2 EMTs on them. One of them, at least, is at the paramedic level. Those are staffed in a static model, so that does not vary with call volume, 24/7, 365. Same thing with fire trucks. We have 3 personnel, infrequently 4, on 7 fire trucks. That includes the crash rescue truck out at the airport, and that also is static staffing, 24/7, 365. We have 1 ARU unit, that's 40 hours a week. So just for comparison's sake, I just want to put it out there that when 1 ambulance is not the same as 1 ARU, 1 ambulance, because it's 24/7, 365, is 8,760 hours of availability, and 1 ARU is 2,080 hours. It's 40 hours a week. And there's other specialty units that are deployed, but I'm just going to sort of stick to the general ones. Dispositions are largely based on policy. There's a really large system that's been deployed, and the most well-worn paths are jail and the emergency room. Key performance indicators for public safety, most of them revolve around call volume, response type, or call type, and crime statistics, response time. So call volume, response time, call type, and crime statistics. And these really weren't designed to understand how well we're doing with these 116,000 encounters per year, only to understand how many calls did you have, what type of calls were they, and how fast did you get there. So measuring and understanding the value in public safety is a task for every member of the community, for every community across the country, and we're definitely no exception. But I'm not here to present sort of on the status quo as much as, but I wanted to lay that out as background. I know that the task force is looking at a lot of these issues in much more detail. So hopefully this was a helpful background. Okay, so MIHO, the Mobile Integrated Health Office. So why did it come around? What's the history? So in 2014, late 2014, I think as Mayor Koss was leaving office, Chief Litzenberg, Mayor Gonzalez, Councilor Rivera, other members of the council passed Resolution 2015-1, which directed the fire department to establish a community protection initiative to sort of understand the opportunities and challenges. So that has passed along. Vision has passed along to now Mayor Weber, Chief Babcock, and Chief Brian Moya. And some of the questions that were asked were, can we identify people with a likelihood of suffering an emergency and intervene somewhere upstream to improve the outcome or reduce the harm? And also, how well our supply matched to the demand? Are we missing opportunities to improve health and safety outcomes? The programming, I'll get into detail in the next few slides, but it can be broken down in two basic categories: case management and response. So you'll see Thrive fits into case management and the ARU fits in response. The training that our staff receive is still evolving, but right now sort of the core curriculum is about 12 hours of initial general operations training, including safety, 24 hours of crisis intervention training, 10 hours of motivational interviewing, 6 hours of suicide prevention, and then 2 hours of each of the following: trauma-informed care, human trafficking, NAMI, and then there's a lot of on-the-job training and sort of ongoing training. We have a couple other modules that we're going to bring on in this next group, and that's dementia care training, 2 hours of that, and transgender cultural fluency from the Transgender Resource Center of New Mexico. So the deployment model for MIHO is for case management. They're in cars and SUVs. They're essentially a day shift. It's business hours. The case manager typically moves around as a single person in their vehicle. Infrequently, we double up if that makes sense, either clinically or for safety reasons. The ARU is always staffed by 2 people. And in the office, we have a total staff of 11, and we have 1 more on the way. So we have 4 case managers. A few of them are on this call. A case manager supervisor. Let's see. I just want to quickly in who we have on this call. So Matt Martin, Felina Ortega, Raymond Espinosa, and Sonia Bertolo is unable to join us today, but those are our managers. Adam Lord is our case management supervisor. We have 3 very experienced paramedics, Ramos Sosi, William Brunson, and Jesse Flores. We have a behavioral health director, a licensed social worker, and that's Nicole Alt, who's also on this call, an administrative assistant, Victoria Velarde, who I don't believe is on the call, and myself. So that's the total staff. The disposition options, so the sort of where we take people, who and what we connect them to. So a lot of it is at home or on the street care, de-escalation, harm reduction interventions, some minor medical and first aid care, a lot of rapport building, connection to new services, and reconnection to existing providers. Working very closely with the Crisis Triage Center, La Sala, and doing handoffs to the mobile crisis response team. Work very closely with the shelters, Interfaith, St. E's, Consuelo's Place, etc. We often end up taking people to their homes, to family's house, a friend's house, sometimes to the hospital, whether that's in the ARU or by ambulance. And I'll get a little more into this in some future slides. So the KPIs, key performance indicators, data management, so number of clients served, referrals and services provided, closure types, referral sources, and more. And we've had a lot of iterations, as is probably common with any startup. Just to give you an idea, I've moved offices 5 times in as many years. So we've had to change software systems a couple of times, and we've really gotten a much better understanding of the challenges of gathering quantitative data collection and program evaluation. We're now actually in the development phase of yet another software system, and we're moving all of the EMS, mobile integrated health, fire prevention, and fire suppression documentation onto one single unified platform, and that's really going to help us with longitudinal understanding of the community that I'll talk about in a little bit. So one challenge is we don't have any data to compare ourselves to unless we stick to call volumes and response times. So it's driven us to question what sort of metrics we want to track for police and fire and EMS activity. And it's one of those things that it's really a paradigm shift. Instead of, so for example, I've heard so many times police chiefs be questioned about what kind of community policing programs do you have? And instead of asking an agency to come up with a community policing, community EMS, or community firefighting program, it's really asking us to have an entirely, just a sort of a whole agency approach, have the entire agency really lean into community service, accountability, community building, being open, being intellectually curious. So KPIs are sort of in development and in evolution. So to wrap this up, the MIHO is really the umbrella group that handles case management and alternative response for public safety. So with that, I'll move to case management, and then after that, we'll move into response.
Andres, really quick, I forgot what you said. KPI stands for what again?
Key performance indicators.
Thank you.
The data points that one tracks to sort of understand what performance is like.
Thank you.
Yes. Case management functions. So why do we do this? Back in 2014, so again, back to the early days, when we were sort of working with Chief Litzenberg, and he directed us to start looking at some of the information, we noticed that those who fall through the safety net, those who fall through the cracks, they end up on gurneys and police cars at a disproportionately high rate. So to give you an example of that, 0.3% of the city's census population, so that doesn't take into account the million room nights and the workforce that commutes from outside of the city, 0.3% of the city's census population made up 18% of Santa Fe Fire Department's EMS calls. And that's a significant underreport because we don't get names often on some of these individuals. So they're sort of termed high utilizers. And in this population, a lot of mental illness, homelessness, alcoholism, senior issues, and sometimes all these are combined and co-occurring, making it really complicated. And the revolving door phenomenon is one that really leads to poor outcomes for patients. It leads to burnout for providers and extremely expensive and uncoordinated care. I think that's sort of a truism now that most people understand. So we asked ourselves, if our mission is to protect life safety and we have access to the most vulnerable populations, Faith can probably remember, I remember we had a long list of anyone who had called 911 several times, and we went down that list and called people and tried to make contact. And I don't know how many times we were told, oh, she died, oh, he died. So if we had this list of the most vulnerable populations, you didn't want to be on that list. Why not act? So prevention is also sort of in our DNA with fire prevention. It's been going on for decades. So we just extended that to all of our calls instead of limiting ourselves to preventing fires and protecting property, protecting buildings. Really, just how do we think about that in a human context? Maybe we thought it could lead to better outcomes, a little less vocational frustration, and maybe even more fiscally responsible systems. So we visited these folks. We called them. We visited them at home. We consulted with community partners, particularly social workers, the folks at community health at Christ St. Vincent's Hospital were super instrumental in sort of informing how we were thinking about this. Southwest Care Center was an early funder and strong supporter. Presbyterian Medical Services, Santa Fe County's Community Services Department. Actually, Director Ochoa was with Santa Fe County Community Services Department then. So all these were just partners that were helping us work our way through these issues. And we quickly realized that often the people who have the most need also have the most obstacles to receiving those services. Especially when those services are offered in brick and mortar settings. So transportation, having a phone, having access to a shower, a refrigerator for your medications, mental clarity, food, et cetera, really sort of things that a lot of us take for granted and really basic needs. And we also noted that there was a huge gap in street-based case management and outreach. So we concentrated on a small but mighty outreach case management team to hit the streets. LEAD is formerly known as LEAD, rebranded to Thrive, was a, let me just talk a little bit about the service itself. So we identify people by searching electronic patient care records. So that's our 911 database. We look for overdoses, we look for mental health issues, and especially when either one of those are tied in with a concerning pattern of 911 utilization. That example that I used at the top of the presentation is a perfect example. So we also receive referrals from our frontline EMTs or paramedics, from Santa Fe Police Department officers. And if our frontline EMTs and police officers are looking for them, they are in a perfect position to be eyes and ears for these sorts of issues. Some of them have gotten very well attuned at identifying risk and referring through the systems that we have, but there's still a lot of untapped potential there. And the sorts of referrals that we're seeing from the field are senior issues, isolation, hoarding, mobility, issues with activities of daily living, adult protective services, that sort of thing. Mental health issues, social service needs, and just general connection to resources. So when we identify somebody, we have limited capacity. Each case manager, we have 4, has a caseload of approximately 20 clients at any given time. And it's really a challenging task to determine who will get enrolled in services, but it's oftentimes a very rich conversation that happens constantly. As new clients are identified, we're trying to make those decisions of when to close people out, when to include people, and just workload in general. The service is really, as I think Faith remind me of Eisenhower quote, I think, or Eisenhower principle. This work is extremely important, so it's not urgent. These are non-emergency encounters. This is slower work. For more urgent needs, we have the ARU, and we'll discuss that in another slide. But we do about anywhere from 1 to many contacts per week per client, and we offer connection and coordination services, and we really try to center all that in the client's self-determination. And we just focus on risk reduction. So this isn't an abstinence program. This isn't a disciplinarian program of telling people what they need to do. And food, clothing, shelter, connection to resources and services, such as getting IDs, income benefits, mental health treatment, substance use treatment, transportation, home healthcare services. Those are the sorts of things that we try to engage people with and connect people with, and try and get them to a level of stability where they can actually then engage with other service providers, so we can hand them off because of our limited capacity. And we never intended to become a case management agency, really more of a navigation, sort of identifying people and handing them off to the right level of care. So the way we close people, ideally, we are handing them off to another provider once they've reached a level of stability that they can make it to a brick and mortar place, keep appointments, et cetera. Sometimes just the client has stabilized enough that even if they're not connected to other services, they're stable enough that they're closed out. And sometimes we lose contact with them. They sort of fall off the radar. Sometimes they die. Other individuals tell us they don't want or need our services. So we may close those folks out, but we monitor them closely because often those are the ones who need the most assistance. So it's just because we don't have someone sort of on our active caseload doesn't mean we're not keeping an eye on, or I should say, just because someone says they don't want our services doesn't necessarily mean that we go away. We're respectful of their space, but we understand that sometimes it just takes a little longer to engage with them. So we just seek opportunities to do that. And then the staffing and deployment, I mentioned this already, they're in cars and SUVs, and they're essentially business hours, and they work under the support of our behavioral health director, Nicole Alt. So as I mentioned, Thrive falls under the case management rubric. If looked at from the outside, you wouldn't be able to tell a difference. It's exactly the same, except for the referral source. But the reason why Thrive and LEAD programs exist, and this is straight from their website, says the goals of law enforcement assisted diversion programs. The goal of law enforcement diversion programs is to improve public safety and public order and reduce unnecessary justice system involvement for program participants. So that's absolutely in line with what we are doing since, researching since 2014, even though we were not involved in LEAD when it came to Santa Fe. So a little history about LEAD and Thrive pre-MIHO. So that's 2014 to 2019. So it was a group of stakeholders that included the DA, Santa Fe PD, the Law Office of the Public Defender, New Mexico Criminal Defense Lawyers Association, the Drug Policy Alliance, a community member with lived experience, and I may be missing one or two. I know Santa Fe County was involved in that. They were organized into something called the PCC, the Policy Coordinating Committee. And that organization was done by a dedicated program manager. The funding for that program was a braided funding stream. There was a sizable grant that paid for the program manager, discretionary spending, evaluation, and a few other things. Now the city funded the case management piece. That was through an RFP out of CSD, and LifeLink was the contracted case management provider. And then I don't know if it was late 2018 or maybe early 2019, LifeLink decided not to pursue a renewal of their contract. When that happened, MIHO was approached by the PCC. I knew that LEAD existed and went to a couple meetings, but we were not formally a part of that. But we were approached because we were already doing case management for public safety involved individuals. We were a little unsure about the future of the program, of the grant sunsetting. There was a grant from the Open Societies Foundation, but the services were absolutely in line with our philosophy. So agreed, we started taking PD referrals. We also received the money that the city was paying LifeLink, which was $250,000 a year. We used that to hire 2 case managers and an admin assistant. When the grant ran out, none of the stakeholders funded the program manager position. So the program itself, the organization of that PCC, dwindled and it essentially sort of faded into the background. Now, the case managers that we hired have had an absolutely full caseload since they started back in 2019. They zero vacancy rate. Now, so since 2019 to present, again, we had low referral volume from the police department. So we started using our 911 data to fill those case managers' caseloads with the very people the program was aimed to serve. And I remember a meeting with City Manager Litzenberg and then Director Ochoa and Chief Babcock about this, saying, we're not in a position to tell the police department what to do or to manage their workflows. We are happy to take their calls, or I'm sorry, their referrals. But if no referrals are coming their way, we're not going to have our case managers sitting on their hands. We will fill their caseloads. That was understood. So that's what we've done. Since then, our case management team has taken on hundreds of public safety involved individuals and offered the connections to these social, mental health, and substance use resources in the community. And they've housed previously homeless folks. They've cleared warrants, attended medical problems, assisted with acquiring benefits, connected to resources around behavioral health and all sorts of other things. The way folks are identified for the Thrive program is a police officer can either during an encounter where there's going to be an arrest, can choose to divert that individual into treatment or into case management, or they can identify someone that they just know from the community who they know is having issues, and they can do, so that would be a social referral, the latter. The former is an arrest diversion. They send us an email, they call us on the phone, and a couple of times they've actually called us out on the radio to show up on scene. And it's interesting, the referrals that we have gotten have been overwhelmingly for individuals that our team has already identified and engaged with. That just shows the amount of overlap that we have, and the richness in identifying people through our data. It's a good radar. And even though we've kept the case managers busy constantly, we have never turned down a referral from PD. So the service and the closure, it's the same as the case management, the previous slide. The only difference on the closure is that theoretically PD or the DA could pull someone from Thrive for non-compliance. We would continue to serve them. We wouldn't kick them off. Just, they just wouldn't have a little Thrive check mark next to their name. And the integration to case management, again, it's fully integrated from the outside. You wouldn't be able to even see the difference. Chief Joy, maybe you want to jump in for a minute here and just add a little bit about sort of the mindset around Thrive and how the ARU fits into arrest diversions and social referrals, and that will take us right into the response slide.
Sure. Yeah. Let me hold on one second. All right. Everyone can hear me okay? Right. Okay. Yeah, so I took over as Deputy Chief of Operations in 2019. Prior to that, I spent much of my command career in criminal investigations, and I had some on and off interactions with the Municipal Drug Task Force. Prior to that, I was involved on and off with LEAD in various capacities. Once I took over as DC of Operations, I've always been an advocate of LEAD or Thrive in whatever form it has taken. What I think is good now, I think as far as my people in the police department, the mindset is there. I think everyone is understanding, again, kind of like what I referenced earlier, addiction and behavioral health, all of these community issues are larger than what, again, the police department can do by themselves, and also aren't issues that can or should be things that we can, again, wrest our way out of. And so what I'm happy to see is, I think the mindset is there. Again, with ARU, what I like and I've been advocating for is, so the disconnect, I think, is not so much now with the officers of like, is this someone that can be referred into services? It's more so a matter of where can I get that handoff? How can I make that handoff? And I think incorporating Thrive into ARU, knowing that they have the capacity to handle it, it allows for that immediate warm handoff from the officer to Thrive. We've been working with myself and Director Ochoa have been working with the DA's office for the diversion aspect of it, the charges, criminal charges, diversion aspect of it, is how we can best kind of work that and monitor the case management on the PD side, and where that case management should be held. Whereas in LEAD, I'm trying not to ramble too much, but whereas historically with LEAD, and Emily Kaltenbach can speak probably better to it than I can, and Monica Alt, but the charges would be filed, and those charges would hang out on the DA side until it was either decided that through the case management that the person was not in compliance with the requirements that LEAD was holding them to, or they were. And so there was a lot of maybe a disconnect between whether or not those charges were still being held onto, or whether or not the person was in compliance in total, and then the charges were absolved. Whereas when we're trying to kind of revive Thrive, I keep saying, I think we're going to try to keep the case management side of it as far as the diversion on the PD side, and have more interaction and involvement with how people are complying and participating in the program. So yeah, rambling at you, sorry.
No, perfect. That's helpful. Thank you. And yeah, these things seem to, we haven't teased it out exactly how yet, but they seem to be on converging paths. So that's a good lead into response and the alternative response unit. So two things sort of converged. So we had on the MIHO side, there had been for quite some time, we've been interested in bringing this longitudinal care that we had developed to the scene of 911 calls. The caseload, the clients that we're working with are so heavily involved with 911 that it seemed sort of like an obvious place for us to interact with them. And at the same time, this is according to Captain Champlin again, the nationwide conversation that began primarily in 2020 was focused on evaluating what police officers respond to, and a specific calls for service could benefit from a more service type response rather than a criminal justice type response. So the way we identify responses or calls for service is the crew is cruising around in the unit. They have a computer screen up. That computer screen has police and fire, all the active police and fire calls. So they read the CAD info, they consider scene safety issues, the call type, the call details, the persons involved, the location. They gather further background. So that may be calling another case manager who's actively working with a person, or that may be calling mom, like in that first example, calling the family, getting some background en route, calling the principal that called in the welfare check, calling whoever it may be, wherever we can get information, the business owner, whoever, to really try and get as clear of a picture as possible. And then they self-dispatch. When they self-dispatch, they can either tie themselves on to the full-on response. That could be, the entire public safety parade, or that could be just a police officer response. So they can either tie themselves to that response if they decide that's appropriate, or they can respond in lieu of, so cancel specific units and modify the response. And so once they get on scene, again, the dispositions are similar. So it's alternate transport destinations to places like La Sala, Interfaith, St. Elizabeth's, Consuelos, a residence, another place, another part of town, and providing that sort of at-home or street level care, de-escalation, harm reduction, connection to services, reconnection with existing services, small items like food, clothing, Narcan, et cetera. And, just really built on trying to handle that encounter, but also handling that encounter with a view to not just as, again, I'm going to quote Faith a bunch today. She has said that in the past, a way that she looked at, or maybe that we collectively look at patients when we're on the ambulance is, how does this patient fit into my shift? And the paradigm shift here is, how do we fit into this person's life? So that encounter is not just about that encounter. It's also about building rapport, gathering further information, trying to understand that person's situation, their social connections, their resources, to try and make sure that we leverage that as much as possible to help those folks self-actualize in whatever goals they may have that contribute to their health and wellness. So the integration to case management, the ARU is essentially a referral generator. We can hardly keep up. So our model right now is 3 case managers per unit. One is actually in the unit, physically on the unit, and then 2 case managers are working a caseload that, so handling the referrals that come in. The case, it doesn't matter. I don't think it would matter to you guys. It's complicated, but they rotate through those roles. But the case managers have, when they're not on the ARU, they're working on those proactive, non-emergency visits to the house or the street or wherever the person is. So then so the ARU creates referrals, but also the case management side generates a lot of information and builds a record so it's really a symbiotic relationship between case management and response activities. The deployment of that and the staffing of that is right now we have 1 case manager and 1 medic, paramedic on an SUV with the support, as I mentioned, of the 2 case managers, the behavioral health director, a case manager, supervisor, and the entire office, really. And they operate Monday to Friday from 8 a.m. to 6 p.m. So I was asked to prepare something on what's working. And I think there are a lot of things that are working. The 911 system and the interactions with community members on the streets and in their living rooms really allows for this little window into people's lives that's unique. These interactions are unplanned. They're on all sorts of terms. They can be extremely raw, but they are very real. You get to know people. You get to know their strengths, you get to know their skills, and you get to know their challenges and their traumas. And we're in a unique position because we're embedded in the system. The data piece, just the access to this, it's a minefield. The 911 data is what makes this all possible. It's what allows us to identify some of the most vulnerable individuals in our community. I could spout out all sorts of high profile events in the community, front page articles, and but I can't, well, I could, but I won't because of HIPAA reasons. But it's interesting how much of a, just how vulnerable these folks are in violence and unfortunate accidents. So this data really allows for these longitudinal records or stories that I've mentioned a few times to emerge. The fire department data has been available to us for some time, since 2014, but now we're just starting to interact with PD data, and I think that there's just a ton of potential there. The experience, so the skills that we pick up as first responders are another enormous strength, and our case managers are really starting to pick these up. So developing the confidence and the skills to navigate just the scene dynamics, the unpredictability of being out on the street. Everything from dogs and kids to crowds and traffic is really, really critical to this sort of work. The positioning, so I've heard of teams that do follow up with vulnerable populations through their police department, and my hat's off to them. They likely have the best intentions in the world, but having the officer who arrested your uncle sitting in your living room offering you help may not be the best model. We find that people are pretty open to a check-in by a paramedic. And then when they meet our case managers, they really just open up and feel at ease. And this is sort of exemplified, this dynamic, by the time we had a PD officer on the unit. Officer Mariah Gonzalez is extremely professional and self-aware. And even with that, some people will get triggered. They would just tense up, get nervous, and just asking that she leave. And she spent a bunch of time just sitting in the SUV, just waiting. And, so this positioning, the fire department is generally liked by the community. And that's throughout, even with these populations. Partnerships, so the partnership with PD has been absolutely key. We learn all sorts of things about the difficult job they're tasked with. And typically the calls they least want to deal with are the ones we're most eager to take. So partnerships also with La Sala, the shelters. Christchurch has given us these 1 gallon Ziploc bags. They're called H2O bags, and they're full of hygiene supplies and food. And that's super valuable in just being able to make connections and meet some people's really, really basic needs. And Quorum, formerly SVH Support, you may or may not know of them, but they're a large funder in town, and they're really committed to being part of some of these community health issues. We have a grant with them, and that allows us to the community Santa Fe Community Foundation, who's a fiscal sponsor, to buy these prepaid cards, and then they just gift them to us. So we can use these essentially as flex spending to buy a client a meal, buy someone a hot cup of coffee on a really cold day, so we can sort of just have a conversation with them and dig in a little bit when they're like, no, I'm fine, I don't need anything. Well, how about a cup of coffee? Okay, sure, I'll take that. All right, well, let's sit down and have a cup of coffee. And now we can start talking. So that's been invaluable. And I really, really want to thank them. If anyone here knows Christchurch folks or Quorum folks, please send them a big thank you from us. And I just want to call them out every time that I can. Leadership at Police and Fire, as well as Director Ochoa, who really look at our calls, and they see 116,000 calls that we need to manage as a team. That's been key. Chiefs Litzenberg, Babcock, and now Moya, Mayor Gonzalez, and now Mayor Weber, the City Council, and really you all, the members of this task force who are involved in these conversations and making decisions about, and just like being creative about what we want our city how we want it to manage the community health and safety needs of the community. All these groups, all these leaders see the needs of evolving, and I guess are brave enough to answer that call. And really that's sort of also part of the wind in our sails. So thank you to everyone on this task force. And lastly, I think realistic expectations. I've talked to a lot of departments. We've gone to national conferences, and we have departments that are trying to do CHF prevention follow-up and readmission stuff and senior falls, and they get a grant and they have to do all this reporting stuff. And it's just, a lot of them go down. They don't have hard funding. They have a hard time tracking data. As I mentioned, a lot of these are startups or just trying to figure it out. By the time they figured it out, they've lost their funding. So really realistic expectations, as I mentioned in the KPI sections, if we want to know if something is working better than the status quo, then we need to develop good, consistent comparison tools. There's no other way to do that. I was also asked to have a slide on some of the edges in growth and sort of some of the challenges. So police and fire EMS models, they haven't changed much since the internet was invented. That's a long time for things to remain mainly static. And there are a lot of people that are taking an interest in how their communities structure public safety. but really, and I think you guys, in some of the early meetings, I heard this frustration. These systems and institutions are largely a mystery and difficult to penetrate. So it's really difficult to perform any sort of assessment, SWOT assessment, strengths, weaknesses, opportunities, and threats, and really get into the meat of it. So a helpful framework to approach this issue from is a concept called community risk reduction, or CRR. And that is the deliberate design of health and safety systems based on actual risk as measured in a well-conducted community risk assessment. So we've now structurally united public health and safety with the city's reorg, and now it's time to restructure our understanding of what's actually possible. I feel like it's helpful to look at these 116,000 annual encounters, look at the data that's available from these incidents, and then try to imagine what the system would look like if we were starting from scratch. And the more people can think of and talk about it in this way, the more productive our conversations can be. Change isn't easy, but not changing will, or maybe already has, run up against some pretty strong evolutionary forces. Another thing, the just improvement of the social determinants of health. In 2015, I told Councillor Boucher that my obsession was to put myself out of a job. I'd love to live in a community where calling 911 is a rare occurrence, where you don't hear sirens, where you don't have an issue with, whatever. We have 30 vacancies in the police department. Doesn't matter. Not a big deal. We don't have the need. We don't need to open a new fire station. We don't have the need. We don't have those. That's I know that's pie in the sky, but if we wanted to address those things, and I know that the governing body and many people in this community are working on these things, but the social determinants of health, improving economic stability, education access and quality, healthcare access and quality, having healthy neighborhoods and a built environment, improving social and community connections, that sort of work would help put me out of a job. And so I think that's an area where, there's still a lot of opportunity, a lot of challenges, system capacity. So the services that we're talking about fall under this case management and response. It falls under the healthcare access and quality area of the social determinants, but we're only one small part of that. So we need improvements in all these areas. The healthcare field, as we see it, is mostly in need of resources that are dealing with behavioral health and senior issues. And then change management. Change isn't always easy, but it doesn't necessarily need to be painful. I think the real solutions would address both community issues and staff issues. So burnout, recruitment and retention, vocational frustration, that sort of thing. In conclusion, as I know this has been long, and sorry, I don't have a time clock, and I should have, so excuse me for that. But this is just really an overview of what we've just discussed. So having a deliberate design for desired outcomes, the use of public safety data to identify those most vulnerable individuals, working together none of us is smarter than all of us. Reducing overall costs. It's extremely expensive to run community health and safety response programs the way we're running them right now. It's unsustainable, I would say. Forget just the city coffers, even unfunded pension liabilities. And then really, one of the most important parts of this vision is increased opportunities, these last two bullets, self-actualization for community members. And to be perfectly honest, the reason that I approached Chief Litzenberg with trying to do something different is I was burnt out. And I know a lot of paramedics that are burnt out. And I thought we have a huge challenge right now. On the police side, I understand that's a gaping hole, and that's a big problem. But even on the fire department side, we have big challenges recruiting and retaining paramedics who are doing a lot of this work, but maybe don't have the right tools or the right support for it. So, so one of the things that I told myself is one of the reasons I'm doing this is because I don't want other paramedics to get burnt out. I don't want other people to get to that point. So if you all, I know I'm probably way over time. I had some case studies, some examples that I would share, but maybe the best thing is to just jump into the Q&A.
All right, thank you, Chief. Let's start with questions. If there's anyone on the committee that has any questions for BC Mercado. And you can raise your virtual hand or just wave at me on the screen and I'll try to or just yell at me if we can't see you. No questions?
We
I
have
a couple
Annie. Annie
Oh,
has a
sorry.
question.
Hi, I do have a couple questions. Thank you. But first I want to thank everyone who's here and thank Chief Mercado and all the ARU team members. I know you all have worked for a very long time and been on the sharp end of success for these teams. And I hear really great things about the work you're doing. So I know we on the task force and the community thank you and for as hard as you've worked for this success. And Chief Mercado, you can answer other team members, but I know it's, you know, it's been a learning curve for the departments. And I want to be conscientious of how I ask this, but you've talked kind of about broad challenges, but I'm wondering if there's any kind of challenges internally with the departments and their understanding of ARUs and commitments to them, and kind of what factors you see you need for these ARUs to continue to succeed and be utilized, you know, as fully as they need to be.
Yeah, members of the task force, I appreciate the question. And I think maybe the biggest challenge internally, so first of all, when I say, oh, the national level, at the national level, I seriously mean it. These really are big industry changes. And I think maybe the biggest challenge is balancing the fact that you still need to operate a department. You still need to, you have CVAs in place. You have sort of expectations, you have culture, you have people that are strongly tied to their sense of what they do for a living and why they're there. And then you have this new sort of disruptive thing that's unclear. And even if you wanted to stand that up and suddenly scale it up, you're having to juggle those two things of, you can't just switch from one machine to the next. You have to have a transition. And that's challenging. Change management is complex. I can tell you that, okay, first of all, with extreme ownership, which is something that I'm trying to get, a lot of the challenges have been myself, trying to push this faster than it would run, and running up against people that weren't ready, making this personal, and saying, why aren't we doing this? And come on, and this is obvious, we should. So I would say that those maybe pointing a finger at myself and then also pointing a finger at the department. It's, first of all, sort of my personality. I really pushed hard early on, and I think that was maybe a little counterproductive. But also, it's just I think that's more of a question for the chiefs and for Director Ochoa and Chief Joy and people that have been in those positions where they have to juggle those two things. I've never had to do that. I've had enough cover to say, go do good work, figure out what you need, tell me what resources you need, we'll try to resource you. So I've lived a fairly sheltered life. And it's hard for me. I mean, I could finger point all day long, but I don't think that's very productive. But so I'll let Director Ochoa.
Thanks. First of all, thank you so much, Andres, for the incredible presentation and all the work of the team, and all of the pioneering that you've done. Since I met you in my role at the county, we were having these conversations about, how to increase access, high utilizers, all of this stuff, and you've been, an incredible leader in this realm. So I just want to thank you for all of that. Member Raskin, I think the question's a great one, and I'll just take a stab at it from my point of view, and I want to pass it to Chief Moya and Chief Joy. I'm not a very hierarchical kind of gal. And when I got put in this position of being the director of the new Community Health and Safety Task Force, I said to myself, thank God for this hierarchy, because it really actually allows us to do quite a lot, right? So what I said is the alternative response is a high priority for our city, our department. And what Chief Babcock said is, I hear you, ma'am, let's make it happen. And then he brought it down, and the way that Chief Moya and Chief Joy have adopted it, not only because of the hierarchy, because it's obviously the right thing to do and to get to, it's just been useful. And what I am trying to get at is that the embedding into the existing and the hard wiring of this program into the way the fire department works or the way the police department works has been powerful, and I think is why it's proving effective. And Chief Moya, maybe you could talk about how you rolled out with Chief Babcock and now yourself, this new service line for the rest of the fire department.
Oh, yeah, thank you, Councilor Rivera, Member Askin. Yes, so it's a very big balancing act. I've been with the fire department for 20 years. I was there when we tried to run out the first unit, Health 1, Health 6, and it was not taken well. So when me and Chief Mercado revamped it and I became AC2, we said, we're going to sell it as the Santa Fe Fire Department. And that is something that I have proven forward, moving forward, is we're one department. We are trying to do the best we can for the community. Bottom line, it doesn't matter who goes to what, as long as that person at the end of the line calling 911 is getting the right services, that is what we're striving for. And it has been challenging. There has been a lot of people that have pushed against me, and we have had to say, it's moving forward. You have to get on board. We will have community, we'll talk about it for 3 months. We met every week. And I said, if anybody is having a problem with this unit, is having, both sides. If the ARU is not running right, or if the field's not cooperating right, we need to squash it. And I think that was something that I envisioned early, and I've continued to do that, where the rumors need to stop. The Santa Fe Fire Department had in the past had a lot of stuff where we would never squash things. We would just let them, fester, and they would get bigger and bigger and rumor mill. And that is something I've tried to avoid, is we need to squash these. We need to say, there is a problem. Okay, let's address it. Me and Mercado would have many conversations late at night of, the unit ran this call and it was not taken well. And we immediately addressed it. We immediately took action, and we didn't say, it's okay, let's just put it on the back burner. And that is something that I'm trying to move forward with, is we have to put these problems in front of us. It might be hard to deal with them. It might be a problem, having those conversations, but we need to be adults. We need to move forward, and we need to say, this is something that's moving in a direction, and it is a good direction, and it's helping the community at the end of the day. And I think that is something that me and Chief Joy, I don't think we've had a better relationship. Unless Councilor Vera can change my mind, of PD and fire chiefs. Me and him talk once a month or once a week at least. So it is something that we've, gained that relationship, where if I need to vent to him or I need to ask him a question that he's seen, that is something that we're starting to see, is we're one department, police and fire working together to try to solve a common goal. And I think that's what we're trying to get at. Chief Joy, you want to add anything on that point?
Sure, and members of the task force, I'm going to try not to be too long-winded. Again, sorry, it's a thing, a habit of mine. I've been, I can go on and on about my thoughts of public safety and the evolution of public safety over the years, and just during my time with the department, and thoughts on law enforcement and as a social science and all the fun things. But specific to ARU, one of the things I've been so appreciative of is we didn't take somebody else's program and try to make it a cookie cutter thing where we're trying to make it fit here and work here. These started with meetings between within our departments, respectively, in the community health and safety department, all of us getting together and having conversations about what we have all been seeing over the years, and how we can, what are some better ways we can do this. From the police department side, my folks, I'm pretty transparent with and easy to read with regard to kind of these topics, where I'll approach it with this. Can we say that what we've been doing has been working? And that was my approach with LEAD and with Thrive and with this program as well. And generally speaking, the answer is going to be no. And say, okay, well, why? And how can we make that better? And so the things that we've been seeing with ARU, I've heard nothing but positive feedback from my folks. And I go back and kind of bounce around again a little bit, is what I've heard over the years, not necessarily from folks in the community, but more nationally speaking, with regard to the types of calls that law enforcement respond to. And the kind of outcry of saying, well, police shouldn't be going to X type of call. And my response to that is, generally speaking, I agree with you. And the reason why the police go is because there historically has been no one else to go to these types of calls. And so where I am a very strong advocate of making sure, to the extent that we can, we should not and don't want to be criminalizing mental health, right? And so I think it's something everyone can agree on. And so, but again, it was 911. This is what I'm seeing. I'm a person on the street and I'm witnessing this criminal behavior. Well, it's presenting as criminal behavior, but when you go beyond that, it's a behavioral health issue or a mental health issue. And so I'm a big advocate of this, and I'm hoping we can expand it and hopefully get these folks. Again, we've seen positive progress. I've received nothing but positive feedback. And I think we're going in the right direction. And I don't want to speak for Chief Mercado, and he can correct me if I'm wrong, but from what I've understood, I think he's been reached out to, or some of the folks in the program have been reached out to from other agencies or other parts of the state. They kind of see, not necessarily take our program and make it fit for them, but kind of how they can figure something out on their own in a similar fashion. So.
Great. And I appreciate all three of your leadership on this and the answer to your question. And one thing that I really appreciated that Chief Mercado talked about was burnout and really preventing burnout. And that's something I think we as a task force want to be aware of, both the police department and fire department, but also these ARU teams, because they are working with high utilizing patients, high utilizers. You talk about mental health issues. And I'm wondering if there's parity for the members of the ARU teams with both the fire department members and police department members in terms of like joining the union, having health insurance, which I think is a big concern, retirement. I was curious about those issues.
So Member Raskin shares lots in your question. I'll start with the burnout issues, the support for that. I also, in answer to the last question, it should be recognized that Santa Fe Public Safety has been very forward in making sure that every sworn officer in the police department has crisis intervention training, renewal of that, as well as access to critical incident debrief and support, mental health support through a contracted service. Last year, we added that crisis intervention training tailored to the fire department folks. I actually sat in on that training with them and learned of the deep need they have for more resources around critical incident debrief and longer term support. So we instituted that this year, where that's being provided to the fire department as in the same way that it has been to the police department. In terms of benefits and access to long-term retirement, et cetera, all of the members of the ARU are union employees in the city, not union employees, so they don't have the same access as the public safety staff at this time. We did have an interesting conversation with the Albuquerque team, and they're advocating for some changes to that at the state level to see if that's something that can be addressed, where these folks are another kind of public safety responder. Could there be a special union for them or a special way for them to get long-term supports? And I think that's very nascent at this point. I don't know, Chief Mercado, it looks like you want to add something.
Yeah, the level of risk is something that Councilor Rivera has brought up in the past, and it's real. You can't have a first responder who doesn't take on a certain amount of risk. They're triaging, they're working with the police department, they have training, they have equipment, they have some contingency plans, but they are first responders. That's what they are. So ACS is looking at it. I think it would behoove the city to start, if we want to build out a force and we want to be able to recruit. I think it only makes sense. Not only is it a risk of being injured in some freak accident, but also just the the challenge of working a 10-hour shift with severely mentally ill individuals who are hallucinating, are covered in feces, bed bugs. I mean, we are interacting with the most challenging individuals in the city for the most part. So I think the level of risk, they're responding, they've been first on a trauma stat, a motorcycle accident on Cerritos in St. Francis. They've resuscitated a person that people thought was just drunk and passed out and was actually in cardiac arrest, resuscitated them, called an ambulance, got them to the hospital. The person was resuscitated. They've crawled in through windows to get someone who had missed several days of dialysis and was on the precipice of death. So they are truly first responders. They are operating in that environment. And I think it's something that's very strange to me. So I won't answer for the union. There are positions that the union has chosen to not represent. And I'm gonna just put it lightly at that. But we have in one vehicle, an EMS captain who's covered by the union, who has 20-year retirement, et cetera, union benefits. And right next to that person, a case manager who's doing the same job, who has a different situation. So I think what Director Ochoa is pointing to, absolutely critical. I think that's an area that if we want to grow, there's a lot of opportunity there to understand what sort of employees are these, what sort of protections do they have, what sort of benefits do they have, what sort of training do they have. Right now we can't even buy them uniforms.
I'll also add to that, sorry to interject, Andres, that said, I mean, we all want to sort of run before we walk. These jobs as city jobs with benefit packages are far more attractive to case managers than many jobs in our community, with nonprofits paying much less. And so these are, well supported. I want to give a shout out to our amazing behavioral health director, Nicole Alt, the licensed clinical social worker who runs the team. The kind of support that she provides the case managers is, really excellent. Hi, Nicole. And so a lot of people want to work for this team. And then with Adam Lord joining as a supervisor, his reputation in the community is really stellar. This is a great job for a case manager. If I can speak for you guys, for your case managers, if you disagree, call me later. But what we're hearing is that this is a really good working environment for them. We will of course look at how to grow that support as the teams grow. But Nicole, looks like you might want to add something to that.
You're on mute, Miss Alt.
Still on mute. Can you unmute?
Sorry, I thought I did. Hi, Councilor Rivera. Thank you to everybody. I just wanted to say that I feel really privileged to be able to give this kind of support and supervision and oversight to an amazing team of people. I've worked as a social worker for a while now, and very rarely did people get the level of support and everything that we provide in our office, and bringing on Adam is a huge benefit. So I feel really privileged to be able to give this kind of support to people who are providing services to the most vulnerable of our community. So that is rare. And if we can continue to build that out, I think that's something for our city to be extremely proud of. And I think the more that we add, the more, if we can continue this same structure and add to that, that will be extremely beneficial in terms of retaining great employees and keeping people from burning out and providing really great and informational training and inspiring training. So I'm happy to be a part of that. Thank you all.
Thank you. Ms. Raskin, you still have the floor, so I don't know if you have any additional.
Well, just one more quick question. Thank you for those answers. We really appreciate it. One of our mandates is to look at race and ethnicity, and I'm just asking the ARU members and chiefs if there's anything you want the task force to think about or be aware of, both in terms of race and ethnicity of the clients you see or the task force itself, if there's anything you want us to ponder.
Chief Mercado or anyone from the team, you want to take a stab at that?
Chair Rivera and Chair Villarreal and Member Raskin, are you referring to the clients we're seeing, to the ARU team, to something else?
Chief, I'm not being specific. I just am creating the opportunity. If there's anything you all want us to be aware of in terms of those issues, to share that with us, because you guys are on the front lines. So both within the department, if there's any kind of race and equity issues you see, or with the task force or with the clients themselves that you want us to be aware of.
I think internally, the Chief Babcock appointed a diversity committee, task force group. Not sure. And I'm not exactly sure where that is, but I think maybe I know that they've been doing some work. I haven't remained very connected to that work. I'm not sure exactly what's happening, but I think that maybe not. They would probably be in a better position to speak to that. As far as our clients, there was one thing that we did notice when we were providing a report, a lead, a Thrive lead report. It was interesting that sort of the racial makeup of the referrals seemed to trend in one non-representative direction. But honestly, just like with our KPIs, we haven't really had the bandwidth to get in there and really dig into these things. We're busy just trying to help as many people as we can. So I'll cede the floor.
Member Raskin, if I may have a thought on that, which is just that, I mean, team itself is very reflective of the community that we're serving in terms of ethnicity and gender. So I think, although you didn't mention gender, I would say that we've got, this is a way to get more women in the fire department. I'll just say it that way, right? Because, we have more case managers who are female than in other parts of the department. So that's an exciting trend. I think that we are lucky in Santa Fe that all of our public safety team reflects the ethnicity and the ethnic makeup and the racial makeup of our community. And I think that actually has gone a long way to making Santa Fe different from many of the other communities that we hear about in the news, especially in terms of police difficulties. So it's not a magic wand, but it's an important way in which we maintain equity in how people are getting responded to. But we do collect data on race and ethnicity, and when we have more capacity to analyze that, I think that'll be an important thing to look at as well.
Great, thank you.
All right, any other questions? We still have one more presentation regarding legislative updates. So Marcella, you had a hand up?
Emily does.
I am trying to put my hand up, but Emily put her hand up first. I just have a follow-up question.
Emily?
Well, Marcel, if you have a follow-up question, why don't you go and then I'll go.
Sure. Well, two questions. One is a follow-up to that, and I have also served on the Immigration Committee, and we had requested on the Immigration Committee information about the number of police officers who are able to do their work in Spanish, if there's incentive pay for Spanish speakers. And so question is just about language access in general for the ARU. And maybe you don't run into a lot of folks who are only monolingual Spanish speakers. Maybe you have a really strong language access component. Could you speak to that? And then I have another question about a community engagement process that we're about to undertake with, hopefully, the UNM Center for Social Research. But I'll get to that question right after the language access one.
Bueno, primero que nada, español es mi primer lenguaje. Faith habla español, Ramos habla español, Felina, Ray, Sonia hablan español y Mar está haciendo Duolingo. Así que estamos, por lo menos en nuestro grupo, I know that there are bilingual incentives. The city, there's nothing special for the ARU, and them not being union members also limits some of that. But yeah, we have at least on from a language perspective, from a gender perspective, from a racial perspective, the ARU and Mobile Integrated Health Office is, I think, a very diverse group. And I think we're unique in that way.
Do you keep track of, and it may just be that you don't, of the number of calls that require interpretation, or clearly you have a nice bilingual team? Is there, do we keep track of that? I'm just wondering.
Looks like Faith can answer that.
It is a field on. Okay, it is a field on our patient care reports. So it's tracked on our 911 encounters through the ambulance. So that's 16,000 calls a year. It's tracked, and it would also, so it would be searchable. We could also do a natural language search to capture when it was talked about in the narrative as an obstacle to care.
Okay, yeah, I'm just curious to see. I mean, the immigrant community it continues to grow in Santa Fe. We saw that with the latest census data, and so just trying to see if we're kind of keeping up, and if we're seeing a consummate growth in calls and referrals. The only other question that I have, and this is sort of a broader question for anyone, for the chief, and we are, as a task force, going to work with Dr. Gabe Sanchez from UNM Center for Social Research, and a few of us are helping him put sort of together a set of community engagement activities for the at-large community. So not necessarily law enforcement or people in the fire department or even practitioners in general, but really just community folks, right? So folks in the community who are people of color, young people who aren't often heard. And I'm just wondering if there's any feedback, because clearly you're getting feedback, which sounds positive from clients and from people in the community that you interact with. But is there anything that we should keep in mind? This kind of is like Annie's question a little bit, that when we're putting together those questions, what kind of feedback would you want from the broader community about the ARU and the work that you're doing that you might not be able to get directly from clients? Just trying to get advice as we proceed with this community engagement process.
We get a lot of calls around how do I get the ARU? Like, how do I access the ARU for my neighbor or for somebody on the street? And so it's really actually goes back to sort of our dispatch system and RECC and how that might be better connected, as well as just capacity. 2,080 hours is not where it needs to be in terms of a community being able to ask for the ARU. So I'm not really sure, I'm not really answering the question very clearly, but I think people have, they read about the ARU in the paper and they're like, well, how can I get that? And so maybe just having them understand ARU, having RECC, maybe understanding how they want to think about ARU are two areas that I'd like to know more about.
I see Mr. Brunson's hand up. Did you want to add something to that, Will?
Well, just to kind of answer that question a little bit, is that frequently, if ARU is requested through dispatch, we're scanning all the calls and we'll see that in the narrative that they're requesting ARU. And for the most part, it seems like the police will leave those up on the screen for us and we will respond to those when we're available. And some of the dispatchers have, gotten quite used to dealing with us and will call us out on the radio to ask us to respond to a certain call if it sounds like something that is nonviolent and seems like it would be a good call for us. So the more time goes and that relationship builds, the more that seems to be a seamless sort of thing between RECC and requesting our response.
Thank you. Anything else, Marcella? All right, Emily, you had Andres, did you want to add to that? If not, Emily had a question.
Yeah, and that community engagement process, I mean, I think it would be interesting to understand people who were previously concerned about engaging with public safety in their time of need, if this is changing their attitude, you know, their attitude changes at all and they're more willing to call for help when they really need it.
Thank you. Emily, you had a question as well?
Thank you. Actually, Marcella asked one of them, so I'm so glad to bring up the community involvement because I think it's really important. First of all, thank you so much for the presentation. It's so great to see all of you. I've worked with many of you in different iterations, thinking about, you know, as Chief Joy mentioned from the municipal drug strategy work, I think this was actually one of the recommendations because it was already sort of in process or been envisioned. So it's really exciting to see what's happened over the last couple of years. I think also just to commend the city continues to lead nationally in these really innovative sort of responses. And, you know, as we look at different models around the country, it's hard to find comparative models. And I think, you know, so as Director Ochoa mentioned, sort of we've already sort of started leading and where can that go? And so I'm excited to think about like how this task force can support, you know, the continuing iterations of this model. And so one of my questions really relates to those key performance indicators that, and that as you mentioned, as being really important to start looking at comparative data. And one of the things that our group is very interested in is looking, and maybe you're tracking this, or, you know, I know it hasn't been enough time, but looking at sort of the calls before and the calls after and what changes, one, in the nature of calls. So have we seen a change in the calls that have come in? Have we seen a change in the response, like who actually responds, and tracking it by type of call? And I know it's complex because sometimes the type of call doesn't quite explain what's going on once, you know, a unit's there. But, you know, I'm particularly interested in my work with Lead and Thrive was to reduce people's engagement with the criminal legal system, if possible, because of the disruption and the harms that sometimes the system can place on someone who's really vulnerable, right? Who don't have the social supports and the other supports to actually you know, support themselves, right? In being a good citizen. So I'm wondering if you're going to be tracking, it's a long question, but the data about like reduced arrests because of ARU, or the types of calls. So that's one question. And then the second really brief question is around, or also hoping that our case managers also are peers or people who have been personally impacted by the types of calls. I see nationally that being really a very successful model. And I know that you're already starting to build that, but I just want to add that it'd be great to see, if not a case manager, could you add another person or a linkage to a peer? And you may be doing that.
Emily, if I could take that, we need to do an evaluation of the team, of the unit, in order to grow it properly, in order to continue growing intentionally. It's the data questions, the before and after, super complicated for multiple reasons I won't take time tonight talking about, but the team is tracking data. We have data that we can share, but it's not really easy to compare that data, as Chief Mercado said. To your second question, I'll let anybody else on the team answer that as well, around peers. I just wanted to mention that the mobile hygiene unit street outreach team that we will be hiring to do outreach to unsheltered people will be a very good complement to the ARU team. We definitely would look to hire peers within that team. And I think they can work very closely together as well. We also really need to look at you know, where dispositions within the community, our partners at La Sala, New Mexico Solutions, all of the groups that are talking about the importance of peer peers in the field and how to really build that workforce up, invest in that workforce, perhaps with ARPA funding and other potentials. So I'm looking at a comprehensive new investment proposal that would help us address some of the gaps in behavioral health. And I think peers are really important, whether they are on this unit or not. I think sometimes they are and sometimes they're not, and that's okay too. I don't know if anybody from the team wants to add.
Matt, do you want to chime in?
Sure. I am a certified peer support worker. I have been for about 5 years or so. I'm also a veteran, so I can relate to a lot of our clients in those aspects. So I feel like I do bring that to the table, but I also would love to see that more integrated into the work that we're doing. I can see the value in just building that rapport on calls and with clients, and it just gives that a different level of connection and their ability to be open about what's going on.
And if I could just add to that, I think that yeah, we would love to have more peers, and not to diminish sort of the experience of peers, but I strongly feel that we're all in this, with some sort of all of our own issues and our own histories, and mental health is really sort of a continuum, and there's all sorts of addiction out there. Very highly functioning people with very significant addictions. But I think that Matt Martin is also has taken some training on supervising peers, and something I think that maybe as we consider the workforce for this and how to scale this up, and maybe this is part of the evaluation, is understanding what those job descriptions should be, and do we have those tuned in correctly now? Do we maybe want to have an opportunity for people like in the fire department? Do we want, if we expect everyone to be a paramedic, we're going to be really limiting our pool. But if we sort of have the understanding that we can train people to do some of this stuff, then it opens up the pool. And I would love to see more people in recovery that are working with us and with all sorts of backgrounds. So I think that that's, in this evaluation that Director Ochoa is mentioning, maybe that's something that we can really explore. Just so how do we build a workforce?
Thank you. Yeah, no, I really appreciate it. And just one tiny comment, I'm excited to sort of see the evolution of sort of Thrive 2.0 as it's merged into ARU. And so looking forward to hearing more about that, to see, are we seeing increases in referrals in that model than we did in the previous model? And are we diverting people out of that arrest situation? So thanks so much.
Thanks, Emily. Any other questions from committee members?
Mary Louise has been waiting.
Okay, Mary Louise.
I have one question. And first, I want to thank everybody that's been so articulate in presenting. We talked about some of your team speaking in Spanish, which is beautiful. Qué casualidad. But I want to ask a question, and then I want to make a comment. So my question is, we are in the state of New Mexico, the only city that has a deaf school. And I am curious as to how many of your staff members can use sign language. And then my second thing is I want to make a quick comment to Paul Joy. Paul, I had the beautiful opportunity of working with you before, and you have been a pleasure not only to work with, but to be a human being that cares so deeply about our kids and our community. And I just want to give you a shout out, and everybody else. But I do want to ask, do you have people on your staff that can sign? And I actually know that one of the police officers, her name is Gabby. She was in one of my sign classes, and she's a police officer. So I know she knows basic sign language. And I'm curious as to if the city pays those employees, if they get a little bit of a stipend or whatever you call it for that as well. So that's my question. And thank you again for everyone your willingness to be here and be present mentally, physically, and emotionally. So thanks.
So I'll jump in. Mary Louise, thank you very much for your kind words. It means a lot, more than you know, and all the things that we've been dealing with. So thank you for that. Actually, DC Valdez and I have been working with some folks to contract with specifically to be more interactive and have some folks who are on standby for us and on call for us to help us out with interacting with community members who are deaf or hard of hearing. I'll have to double check on the union incentive pay for sign language. I don't think that's included, but we're in negotiations now. I think that's something we can discuss. And yeah, Gabby's great. So good call.
I know Felina was just showing me how to say have a good weekend, but I don't know if that's all she knows. I know that on the ambulance before when we need to communicate with folks that are hard of hearing, we use pen and paper or any other method available, but I'm actually looking at the rules and regs right now.
Give me a minute, Ben. Thanks, Chief. Any other questions while we wait?
I have a lot of questions, but we don't really have time tonight. And I just wanted to thank each of you for taking the time to join us tonight, and whether you were able to speak or not. I'm just looking at Raymond and Adam and Faith and Phil and Mr. Brunson, and who else am I missing? I just appreciate you all taking the time. Matt, Felina, Nicole, there's a lot of pieces to make this work, and I appreciate your commitment to it, and the just curiosity and the ability and willingness to make this work, because I think we have a lot of potential, and so I just wanted to mention that. And I was disappointed though, you said 1 ARU. I thought we were already up to 3 ARU units running, that we were working towards up to 3, because we had approved that through budget.
Counselor, I can speak to that question. We have 1 unit up and running right now. The second unit, we are trying. We were able to hire 1 case manager, and the other 2 were not able to get through the screening through HR. So we are still trying to get enough support staff. So we do not want to start the second unit and then fail. So we are trying to build the base and work forward. So me and Chief Mercado's, our plan was to get it up in April, but with only hiring 1 more case manager, that would only lead us to 5. So we are still trying to fix before we just start sprinting a little faster. So we have funded for 2 ARU units at this time. So that is where we stand right now. So we have ARU unit 1 working 5 days a week, and we are trying to get to as fast as we can.
Thank you. Thanks for that. We can follow up with that after. I'm just curious if there's things that we need to if HR is screening correctly, is all I'm going to say. And I will stop talking.
I have a quick question. Chief Joy, go ahead.
Oh, sorry, Councilor Rivera, I just wanted to follow up. It's the State of New Mexico Commission for Deaf and Hard of Hearing persons that we've been working with. And so they've also offered to help us out with training our staff and working on an MOU. So still wanted to follow up on that for you, Mary Louise. Thank you.
Thank you, Chief Joy. Appreciate that. I had a question because Chief Mercado mentioned it, and I've been critical of really safety and having PD respond. And I understand 100%. I've been there that, sometimes people don't always respond well to a police officer being there. But really, I want to ask Mr. Brunson, because I know him, do you guys feel 100% safe when you respond to a mental health patient or a call?
Yes, actually, I feel because we have the choice whether to take a call or not, I do feel quite safe. A lot of times there's a lot of legwork that goes into a response rather than just taking the response and, just running with it. Well, a lot of times we're calling the caller. We're looking up their name in our history to see what sort of interactions we've had with them before. And a lot of times prior to asking the police or the dispatcher to send the response from the police over to the ARU, we'll actually drive by in the truck and just sort of, because a lot of these incidents that we respond to, the welfare checks and the disorderly conducts, it's usually somebody on the side of the road or something like that. And, we'll drive by and sort of have an idea. But if there's any question, if there's a safety concern, we won't go. Or what I will do sometimes, it'll just put in the CAD notes that ARU is available to respond and we're waiting for a police officer response, and we'll be responding with the police rather than on our own.
And are you keeping track of those calls, or maybe you have to wait until police are available to help you guys out?
We are. What I'll do is I'll actually put it in the notes and usually just kind of listen in and wait for the police that are responding to kind of call us on the radio. But we are keeping track of maybe I should let Andres answer that question of when we go with police or when we do go by ourselves.
Chief Mercado?
We are keeping track, and I'm sorry, the presentation was long enough, so that's why I didn't add the data slides. We'll present those to Quality of Life, I think soon. And as Director Ochoa said, we're happy this information is out there. We've presented to public safety and happy to share that. So we are keeping track of any notable safety events. We're keeping track of how many times we've responded with PD, without PD, have been able to cancel PD, have been able to clear PD earlier than they maybe normally would have cleared. We don't keep track of how many times we're sort of waiting around for PD because we don't. There's enough calls that, as Captain Brunson mentioned, you could put in a note and just say, we're available for this call. We sort of have a little bit of background. We've talked to mom on the phone and we're monitoring the call. And then if PD out, whenever PD out, we're not pushing them to go take calls. They're busy enough. So we're not really asking them to do anything. But adding those notes and then as it's appropriate, sort of interjecting ourselves when it is appropriate, and just if it's not appropriate, there's plenty of calls out there, so we'll just go fishing in another hole.
So Captain Brunson said that they have the ability to, I guess, refuse to go on a call if they feel like maybe there's a safety concern. Are we keeping track of those?
Well, it's not so much refusing to go on the call. It's just screening whether you're going on the call or not, because they're not being dispatched. So we're not turning down any calls. So they look at every single call on the PD queue. So you could say that every single call that they didn't go on is a call that, either they were busy or they determined it just wasn't appropriate for them.
So if we turn down a call, who goes on it? Or if ARU turns down a call, who goes? Who responds?
Again, the ARU is not turning down calls because we're not being dispatched. But let's say in the event that the dispatcher said, ARU, we want you to respond on this call, they'd be more requesting, but those calls are on the queue for PD and fire or both, PD or fire or both. So it just gets a normal response. Obviously there's 2,080 hours versus I think it's 120,000 hours of fire apparatus availability, fire and ambulances. So and those 2080 hours, that's most of the time they're committed. So most calls in the 911 system right now are being handled by police, by patrol units, ambulances, and fire trucks. So we're not changing anything about that. If there's a call that the ARU, it's a Saturday or it's 7 o'clock at night or it's 6 o'clock in the morning or they're busy on another call, it doesn't change the workflow whatsoever for PD or fire.
Right. Just one quick comment about the retirement for case managers and potentially being on the fire plan versus the municipal plan, I guess. But that's all state, right? That has nothing to do with the city or with how we do things. I mean, that has to be changed at the state level. Is that correct, Director Ochoa?
That is correct, sir. Yes.
Yeah. And then just one last thing about, you talked about burnout, and I get it. I was there at one point in my career and thankfully was able to promote and move on. But I hope I believe now we're limited in the hours and the days that we are responding to certain things. And as that increases and potentially becomes a 24-hour response, since mental health issues come at all times of the day and night, I hope we're looking into how we address burnout sooner than later. Because you're right, you're dealing with really difficult patients and difficult situations. So I hope we're looking forward into how we deal with burnout as we move forward. So I just wanted to make that comment. So just one last thing, I am doing a ride along tomorrow with Officer Gonzalez with the police department, who is part of the ARU response, and hopefully I'll understand a little bit more after that. But Chief Joy, does she respond in traditional police uniform, or is she dressed down, I guess, for lack of a better response to the question, or a different way to ask the question? Does she look like an old person?
Right, Councilor Rivera, sorry. Yeah, so she's not dressed in the same kind of uniform you see me in. She's dressed down in a polo. She's got some BDUs on, but I mean, she's not too terribly hard to identify that she's still a police officer. But she's not dressed up in all the fun stuff like I am.
All right, well, I look forward to the ride along, so I'll be there as close to 8 as possible. Thank you, Chief. Any other questions? I don't see any. Miss Applewhite, you have your hand up.
There we go.
Thank you. I just wanted to know, you did mention the 24-hour nature of the incidents, and it gets really slow in the middle of the night, but just since we've been talking, there have been 9 calls that the ARU probably could have taken just based on the CAT, and 1 internal field referral from a paramedic who was out on a call with a behavioral health patient and set the flag to the case management team that this patient needs follow-up tomorrow. So for some context in terms of contemporaneous reference.
Yeah, thank you. Thank you, Miss Applewhite. Or are you captain now, or lieutenant, or paramedic Applewhite?
Chris, we have some people waiting. We have another presentation too.
All right, who else is waiting to ask questions?
Monica has her hand.
Oh, Monica.
I just
Go ahead.
wanted to thank everybody for the presentation, and it's so wonderful to get on one of these Zooms. And I not only see family members from both sides of my family, but also colleagues that I've now known for decades, and also to Chief Joy, who I've had the pleasure of working with since I was probably a law student back in 2011. So I just wanted to thank everybody, and I really appreciated everything that everyone had to say.
Thanks. Anybody else? I can't always see hands up, so just if you have a question or comment, please chime in.
You're clear, Chris, so far.
All right, well, let's move on. We have a quick legislative update from, I believe, Emily.
I think it's going to be both myself and Monica. She's going to kick it up. I do want to mention we sent out the handout before this call. So if you didn't see it, it's in your email. I don't think we'll bring it up on the screen, right, Monica? Or do you want me to share? No. Okay.
No, I mean, we have 3 minutes, so we're going to sail through this. I think what I want to just start off with is that there's still some time for there to be the introduction of some legislation. There are several pieces of criminal legal reform from all ends of the spectrum that are being introduced. Please take a look at the list in your email. If you have additional questions, reach out to me or Emily. I probably can't speak to every single bill and what's going on with it, but we tried to organize it a little bit. I think I'll just start with the way that we organized it. We have several bills that create new crimes that can already be prosecuted under current law. There's a grip of crime or a grip of bills. There's also bills that increase sentences or alter the statute of limitations. So there's sentencing enhancements for a variety of different things already existing. Some of these bills, for example, brandishing a firearm, they want to take that from 3 years to 5 years. And there's several other bills, which we won't completely get into because now we have 1 minute. There's also some bills that both create new crimes and enhance penalties. So they do both of those things. One of them is a governor-backed bill, and that's House Bill 68. It was actually up in committee during right before we came onto this call, and it looks like it got rolled. When a bill gets rolled, it usually means there's some sort of problem. So we'll see when that gets, if it gets reassigned or if it doesn't. There's bills and resolutions that alter pretrial detention. This has been in the news a lot. I'm not sure if people heard about it. We could have a robust discussion, but there's actually 3 bills and 1 resolution that addresses this particular issue. One of them is backed by the governor, and that's House Bill 5. She had a press conference. There's been a lot of news about it. We also have several bills that meet the New Mexico Safe Coalition standard. The New Mexico Safe Coalition is a coalition that both Emily and I are also a part of. There's several other organizations that are a part of it also. And I'm going to kick that off to Emily briefly just to talk about what the New Mexico Safe standard is and a quick listing of the bills that meet that standard. And again, we're happy to go into this in more detail if we have more time at a later date.
Yep. Thanks, Monica. I'll just also add that Somos is a member of that coalition as well. It's about 30 plus community-based organizations. And we were formed originally to think about how we can re-envision our public safety world from a policy perspective, so that we're really addressing some of the underlying issues around health and economic instability and other housing issues. And so it's a very holistic sort of approach to public safety. So we formed a way to grade legislation. We have a litmus test, so we don't take a position one way or the other on a piece of legislation, but we will provide our lawmakers with a rundown of, actually with a grade, what are some of the strengths and weaknesses, what does some of the evidence say? So what is our litmus test? It stands for SAFE. So the first one is it safe for our community? So if we look at a piece of legislation, as I mentioned earlier, that we often, the best thing is to keep people out of the criminal legal system. And so that's one of the things we look at when we're grading that legislation. Sort of, is it investing in proven strategies that keep our community safe? The A stands for apolitical, because we know oftentimes legislation is introduced for political reasons. And so we look at that about whether this is really about political gain or fear or tough on crime when it doesn't actually have evidence-based outcomes. Fiscally responsible, so really important to look at, are we spending money on a public safety measure that really has good outcomes or not? Oftentimes, some of these public safety measures don't increase safety. And so we look at the fiscal impact, and then is it evidence-based? So the bills that so far we have graded, and you can go to nmsafe.org and you can actually look at our report cards, what we're looking at this year, what some of the issues from the past. HB 81, the fines and fees, and Monica will be sharing more about that. She's the expert on that. There's a bill to allow for drug checking equipment and supplies. Currently, it's still considered paraphernalia. And so this would take it out of the Controlled Substance Act for those, for whether it's fentanyl or other adulterants in our drug supply. That's actually a governor's bill. The SB 29 is looking at medical and geriatric parole procedures, because we know there are many people in our prisons and jails who are older and have been there a really long time and are no longer a threat to public safety. And then Senate Bill 43, which I think is also a governor's bill. Is that right, Monica?
It's not a governor's bill, but it just received a message.
Got a message, okay.
And I'm happy to, the thing that's interesting about this particular bill is it's actually really not that controversial. It just allows for a child, or who was sentenced as a child and who has been in custody for, a very long period of time, to actually have a hearing in front of the parole board in the hopes that they may get released, and that parole hearing is granted. So that's really all this bill does, but it's received a lot of opposition, but it's looking a lot better as of recently. It's been an interesting thing to watch the advocates really push, have community groups push the governor and others on this issue. There was one other bill that I really wanted to highlight for everybody, just because I think it's relevant to some of the work that we're doing. And I thought, since, I guess we just have fire now, but police and fire might be interested in this, which is HB 96, which is the Violence Intervention Program Fund and Creation. It's a New Mexico Sentencing Commission bill, which the fines and fees bill is also a New Mexico Sentencing Commission bill. But what it does is it creates a fund and also has an application process, et cetera, where cities and counties can actually apply for this fund and the bill goes into sort of a litany of criteria that you need so that you can get this money to apply it to some of the more interesting programming that different cities are doing to combat crime. So I know we're already 5 minutes over. We'd be happy to discuss all of these bills at more length, and we're very capable of doing that, but we want to be respectful of everybody's time.
Thanks, Monica. Emily, anything else?
Nope. Thanks. Yeah, reach out. And maybe the only thing I'd say is maybe at each of our next meeting, we could do a quick 5-minute update if people are interested, and if what bills are actually moving and whether they have a chance at getting to the governor's desk.
And also specifically for the fines and fees bill, and I would assume also for the drug checking bill, if people have an interest in these and they want to ask questions and maybe they're available to make public comment in support of the bill, please reach out to us, because we'd love to chat with you more and we'd love your support. I'd also like to highlight that Matthew Martin is on the New Mexico Advisory Board for Fines and Fees. So he's a member and we're so happy that he's part of it.
Yay, Matthew.
I know.
I will do a plug then, now that you did it. Tomorrow morning in House Health and Human Services Committee, the drug checking bill will be heard. I think it's third on the agenda. So if anyone wants to log on, you can make public comment and support it. And I think it'll be moving fairly quickly through. So thanks.
Process question. Can we send out on this listserv the links to committee hearings as they come up for state legislation? Is that okay?
I think it should be okay. I don't see a problem with it.
Great. I'm sure that there's others that are working on other bills that may want to do that also.
Thank you. Thank you both. Any working group communications?
Before we go there, I'm wondering, to honor the work that you all did to put this together for us tonight, and we really didn't get to give you the time that you deserve for all this work to just even compile it. I know that was a lot. So I'm wondering, for those of you that are still on with us, we can definitely send that out if you're interested. If you can just let us know any of the city staff that is interested in that. And then I think in the next meeting, depending on when we have it, to actually have time for follow-up on these and to give you all time, not just 5 minutes. So if you want to, I mean, I think it's a lot to just navigate through the legislative session, but to like also track these and let us know how things are going and proceeding or not proceeding would be, I think, helpful. And just to honor your time. So thank you for putting that together. I'm sorry that we ran out of time. We should have known better and actually I thank you, Chief Mercado, because there's a lot of components to that. We should have known that there was 3 pieces to this that were going to take a lot of time. So maybe we could just, time better, allocate our time better.
I think it was fun. We're not that far over, and it was a great presentation and great questions, and I think we're all good. So appreciate it. But I do agree with Councilwoman Villarreal that Valeria, maybe we can allocate some time for legislative updates at the next meeting, and maybe give them a little more time than they had tonight. But appreciate the handouts and the email early on. So that was great. Working group communications. I don't think probably there's anything there. Matters from the task force.
We have an update, actually.
Do we? Okay.
We do for policies and practices. We're close to finalizing our questions that we will be providing for staff in the different areas that we've been focusing on. So we're finalizing that and they'll be going out this week to staff. Their requests for information. So if any of you that are not on that working group want to see them, and actually thinking about it, maybe you have more questions to add to our current list of questions. So if you want us to send that to you once we finalize it, to see if you want to add anything to the list related to those topic areas, please let me know if you want it. Well, maybe we should just send it out, I think. If you think Annie and Bruce, it would be helpful to get more feedback.
I see a thumbs up from Annie and a thumbs up from Bruce. Sounds good. Anything else, Councilwoman Villarreal?
I think that's it. Anything else from our working group?
Okay, don't see anything. Matters from the task force? Monica?
I just wanted to add one thing that I really appreciated that came up recently in a LFC report that I think could be really useful for some of the work that we're doing. But this just sort of reiterates that, which is they have a section on victim and community needs, and the Legislative Finance Committee that puts out, these huge compilations, reviews of programming, budget requests. They acknowledge and they state in this section that a wide body of research indicates that most offenders were themselves victimized. Meeting victim needs can therefore address both the consequences of crime and one of its root causes. And I just want to share that and say that there's so much good stuff in this report that we can use for other things, and to celebrate what Andres has been able to do too by providing all of these services. So Andres, Nicole, the city, but providing services to people that really need it, and people that are both victims and alleged, potentially alleged perpetrators of crime. So I just wanted to shout that out. And I'm going to share that with everybody too. As resources come up during the session, I'll try and share it with the group.
Awesome. Thanks, Monica. Anyone else?
I have one thing to say.
Sure.
Go Niners, baby.
Oh my gosh. All right. Anybody else? All right. With that, our next meeting is Tuesday, February 8th. With that, we are adjourned. Thank you all. Appreciate you all. I know we went over, but thank you all.
Thank you.
Thank you, everybody.